Hello, thank you for joining us for Unite for Sight's webinar about teaching cultural competency in global health. We are thrilled to have all of you with us here today. My name is Jennifer Staple-Clark, and I'm founder and chief executive officer of Unite for Sight. I'll start by briefly introducing you to Unite for Sight and then review the webinar logistics, and then we will hear from our expert panelists. Unite for Sight is a global health nonprofit organization that promotes high quality for all. We offer extensive global health and social entrepreneurship education programs. Our Global Health University program offers a free webinar series, including today's webinar, and we also offer 20 online certificate programs for students and professionals. Many students receive academic credit for completion of the certificates, and professionals often pursue the certificates for professional development purposes. And the certificate topics range from a certificate in global health and a certificate in global health research to a certificate in cultural competency, as well as 17 other certificates as well. And we have nearly monthly webinars, and we will have additional webinars again in January and beyond. And we encourage you to stay updated and registered for these free webinars at uniteforsight.org/webinars. Additional educational opportunities for students and professionals include participation in Unite for Sight's annual Global Health and Social Entrepreneurship events, which focus on responsible global engagement. Last week, we had our 4th annual Social Entrepreneurship Institute, and next we have our 14th annual Global Health and Innovation Conference, which is the world's largest and leading global health and social entrepreneurship conference, which will be held at Yale University on April 22nd and 23rd, 2017. And we continue receiving abstracts for review for social impact pitches, which are then submitted to expert panelists at the conference, as well as for an innovation prize, which is a $10,000 and a $2,000 cash prize for the best pitches presented at the conference. And our next upcoming deadline for the abstract submissions is December 31st, 2016, so in just a few weeks. We also have healthcare delivery programs that provide care to patients living in extreme poverty. And we partner with phenomenal local eye clinics in Ghana, Honduras, and India to provide quality eye care to patients who are otherwise unable to access or afford care. These programs are locally led and managed by local medical professionals, and this collaboration has provided eye care to more than 2.2 million people by local doctors during the past decade, including more than 95,000 sight-restoring surgeries by local ophthalmologists. Unite for Sight is the world's only organization that is both a healthcare delivery organization that directly delivers care while also offering immersive global health education and social entrepreneurship opportunities for students and professionals. And the participants support and learn from local doctors in Ghana, Honduras, and India as they provide care to patients living in poverty in villages, slums, and refugee camps. And participants learn from the local medical professionals about patient barriers to care and about effective strategies to reach the hardest to reach patients who are otherwise unable to access or afford care. And the local doctors are phenomenal social entrepreneurs who design effective and innovative strategies to eliminate patient barriers to care in their local communities. Now that I've described a bit about Unite for Sight, I'll next describe the basic logistics of today's webinar. We are so delighted to have all of you with us today. We have more than 1,400 participants, and we have incredible panelists who have a wealth of expertise to share with you during this next hour. Each of our panelists today will start by giving a 2-minute introduction about themselves, their current role, and their key guidance and advice about cultural competency and teaching cultural competency. And we also received many stellar questions from you, our audience, by Monday's question submission deadline, and the remainder of the webinar will then be dedicated to questions and answers. If you have additional questions today, we invite you to submit those in the text box on the tip of your webinar screen, and we'll then select additional questions today to ask the panelists as well. We also encourage you to tweet about the webinar, including your key lessons learned, by using the hashtag GHUWebinar, and you can see the hashtag in the webinar visuals on your screen. Now we will proceed with having our panelists introduce themselves in alphabetical order. I'm delighted to introduce you to our first panelist, David Boies. David, please begin by introducing yourself, your background and current role, and please share your key guidance and lessons learned regarding cultural competency and cultural humility.
Sure, Jennifer. And first of all, thank you for inviting me to be on this panel. I'm a professor of global health at the Duke Global Health Institute. My background actually did not begin in global health. I was actually a humanist or a medievalist, and during the AIDS epidemic, I resigned from my position at Penn and retrained in traditional Chinese medicine. So we are trying to provide palliative care at a time when we didn't have ARVs. That slowly shifted me into working in hospitals and palliative care, and then getting interested in providing palliative care to different groups, which led me into learning more about indigenous health systems and beliefs, ultimately culminating in my going to Vanderbilt and working in the Center for Medicine Health Society, and finally ending up at Duke in the Global Health Institute, where I not only teach some of the introductory global health courses, but I teach courses in indigenous health systems, working with vulnerable populations, and I run a student research training program in Guatemala where we work with indigenous communities up in the Western Highlands. I think if I had to sort of summarize what my best advice would be, or my best thoughts would be really, I guess first is students are very afraid of the idea of cultural competence because they're so afraid they're going to do something wrong. Oh my God, did I show the sole of my foot to someone when I was, sitting on the ground? So I think that what I do is I actually have them understand that this idea of cultural competence is, learning cultural competence is not anything new. They're engaging in cultural competence all the time, but rather it's an expansion of skills that they already use, and that it's not so much about just learning and understanding cultural difference, but it's also about having a kind of empathetic awareness in which they become aware of their own positionality when they're working in a different setting.
Excellent.
And
Thank
finally,
you so much, David. Go ahead.
Oh, one more word, sorry. I think I would also say that I actually have increasingly begun to use the term cross-cultural efficacy as opposed to competence, because I'm not certain that I'm even completely culturally competent in my own culture sometimes.
Fantastic. Thank you so much, David. And Paul Ellingstad, please also introduce yourself and also share your key guidance and lessons learned regarding cultural competency and cultural humility.
Hi, thanks, Jennifer. Delighted to be joining the webinar today. So my name is Paul Ellingstad, and I've spent my career in the private sector, specifically in the technology sector. And on the back of experience and what I call battle scars, working globally in a variety of roles across marketing, strategy, communications, and operations, I became an early convert to the creating shared value model and became an early practitioner of that back in 2009, and have been specifically focused on global health and applying that for global health ever since. Today, I'm a management consultant and advisor focused on change and innovation. I work with leaders and practitioners in business, nonprofits, and governments to find better ways of creating social and business value. And I think the main lesson that I have learned is inspired by a quote from Einstein. He had said, if I had an hour to solve a problem, I'd spend 55 minutes thinking about the problem and 5 minutes thinking about solutions. And what I apply from that is that, it's very easy, to sort of jump in and start thinking about the solutions, being conscious of cultural differences. And many times, we think about cultural competency in the context of, different nationalities or ethnicities. But particularly in the global health space, increasingly I've seen that, we focus on differences, in technology and other elements of cultural competencies, differences in backgrounds and experiences in that. So I've learned that it's very important to check your assumptions, suspend your judgment, and seek to understand. The very first assumption in that to check is why you are engaged in a particular project or in this work in general. All of that context matters greatly to understanding cultural competency.
Wonderful. Thank you so much, Paul. And Vanessa, Kerry, please also introduce yourself and share your key lessons learned. Vanessa, do you on the line? We may have lost Vanessa. We'll proceed on with Jordan Levy while we get Vanessa back on the line. Jordan, please introduce yourself.
Wait, I'm here. Hello?
Oh,
Hello?
great.
Hi.
Yes, we hear you.
Sorry. I'm in Boston and the wind blows with AT&T and it goes away. So I'm sorry. I was sort of talking and I realized no one's hearing me.
Okay, now we hear you. Yes.
Oh, great. My apologies. So I'm Nessa Terry. I'm the co-founder and CEO of Seed Global Health, and we're a organization that builds healthcare capacity in sub-Saharan Africa for now, hopefully elsewhere soon. Really focus on the idea that we want to disrupt the notion that there need to be two standards of healthcare in the world. And we do this by investing in the human potential with the idea that people can be change agents if they're given the tools to do so. And we do that through education. And we've trained over 8,300 doctors, nurses, and midwives in 3 countries in our first 3 years. And this year we've expanded to 2 additional countries, Swaziland and Liberia, and have doubled the size of our program. And that's really been in response, I think, to the places that we work, the demand for our services. And I think the fact that we are a different organization and we do things differently. And one of the ways we've done this is that we put our health professionals in the field for a minimum of a year, because we really believe it takes that kind of time to build trust, partnerships, and to understand where you're working in a way that you can be really helpful. And I think that for folks, it can be really overwhelming to go, we call it the voltage change, when you go from a place where you're used to technology, you're used to having a set of tools and way of thinking, that guides your way of thinking, and then you go and you try to practice and you try to teach in a place where you have far less of those tools and resources. And so as a result, it takes time to make yourself the best version of who you can be in this role and understand where you are. And we really, I think the thing that we have learned is that it's really important to not assume that you have the answer. And even though you come in and you can see all the things that you think are wrong, you may be right in some of it. Things could be done differently or better. You want to be careful that you're not carrying forward the bias of the experience that you have, because we have discovered that many times our partners know exactly how to fix something. They just don't have the resources or the bandwidth to be able to go. So we've really encouraged our volunteers to spend their first 3 months looking, listening, learning. We tell them to go to weddings. We tell them to go to funerals. We tell them to take their counterparts out to tea, but to really build and foster a bond of trust. Because once that happens, then the real work can begin. Things can really begin to change. And I think that you can't underestimate the onboarding that it takes to host somebody and the energy it takes to explain to somebody, even something as mundane as where the medicines are kept. That's extra time, extra effort. And if you're doing that repeatedly, as people come through over and over again, that can be very difficult. And so we've tried to really respect that. And I'm not saying that's the only way to do things. It's just the approach that we have certainly taken. And, and I'll share some stories later about where I think that has sort of helped. But I think the biggest thing that we've learned is just the humility of knowing that the solution may be there. It's just that our program tries to help allow that solution actually come to life, by following our partners' leads.
Excellent. Thank you so much, Vanessa. And Jordan Levy, please also introduce yourself and share your key lessons learned.
Hi, Jennifer. Thanks. I really appreciate being a part of this discussion as well. I'm currently the Chief External Relations Officer for Ubuntu Education Fund. And Ubuntu is a nonprofit organization, and we provide world-class health and educational support to orphans and vulnerable children in specifically Port Elizabeth, South Africa. And our mission is simple, but we believe a bit radical, to help raise township children by providing what all children deserve, which is everything. And for me, my story coming in to this organization as a volunteer who was supposed to stay for 6 months and ended up living there for 11 years really ties into the theories I've developed about cultural competency and cultural humility. But I'm gonna have a bit of a hard time articulating it better than David did earlier. I thought what he said really embodied what I've learned on the ground as well, and it goes back to a foundation of logic, really, in a lot of ways, and sometimes I think we overcomplicate it. And I think there is a big difference between the competency and the humility, and I think we have to focus maybe on the humility first, because it's more foundational to all of us, and competency is learned over time in any field. And if we go back to the logic of how we build humility in any situation in everyday life, that of course is going to apply in any culture. And one thing is you have to realize that competency is time-based. It takes time to gain the experience. And true humility is going to come from experience. So Vanessa touching on onboarding and getting the real experience and indulging and getting in depth with that immediately is essential, because you need to build that experience. And I think structurally we have to put people in the right positions to get that experience, not be overwhelmed and put in the wrong position where they are susceptible to making tons of competency mistakes before they have the skills, but being open to others' point of views, diving right in and getting to know people. I think mistakes, in my experience, mistakes of breaking rules of culture will be forgiven and often even laughed at. But mistakes of not being humble in a logical way that you would apply to any other in your life are harder to forgive, because they come off as an attitude that maybe you do know something more than the other person you're talking to, or that you feel you have the solution, as was described earlier. So I think the humility is a huge point, and understanding that it will be a long-term process.
Fantastic. Thank you so much, Jordan. And David Calcier, please also provide your key lessons learned and introduction.
Okay, thank you. Yes, I'm a professor of nutrition policy at Cornell. I'm actually a biological anthropologist by training. I happen to be in a department that is very multidisciplinary, so I fit well here. But my origins as a biological anthropologist do sort of shape the way in which I've undertaken my work over the last several years. Most relevant to this webinar is that I'm one member of the core faculty in my department that administers a new major, a global and public health sciences major, in which all students have a requirement of spending 6 to 8 weeks in a community engaged experience in a low-income country. And that is sandwiched in between a pre-engagement course and then a capstone when the students return. So that's my current involvement. Professionally, though, over the years, as distinct from working strictly at community level, most of my work has been with policy and programmatic stakeholders at the national level, typically, either government or in the donors or in the large NGOs. And so I certainly would echo what everyone else has said about the importance of humility and respect and replacing judgment with curiosity, not just suspending judgment, but replacing it with deep curiosity, and the importance of self-awareness going into the situation. Interestingly, this is just as important when working at the sort of institutional context that I do as it is working at community level or in a homestay. But I think to add something that others have not talked about yet, I think it's also part of the cultural competence going in, especially if you're working with organizational stakeholders, is to have some grounding in the country context, the history, the national identity, the ethnic and political diversity that exists within the country and the tensions. the geopolitical relationships of that country, especially with the U.S., so that the students are aware of how they are perhaps being perceived simply because of where they're coming from. And then something about certainly the health problems of the country, but also the organization of the healthcare system, so that it's another way of showing respect for your hosts, that you already have done some preparation. And that's in addition to sort of the cultural norms and cultural etiquettes that others have made reference to. So I think I'll stop there and turn it over.
Wonderful. Thank you, David. And Lisa Russell, please also introduce yourself and share your lessons learned.
Okay, well, thank you, first of all, for having me. I love this topic. So I work as a filmmaker, but I did not go to film school. I started off my career getting my master's in public health in the late 90s and landing my first job in Kosovo and Albania, working with refugees and in refugee camps, really developing programs for women and children. And it was there that I had a really firsthand look at sort of how powerful the media was, both in terms of it helping our global relief and development efforts, but more so, I think, harming it. And it inspired in me a desire to use sort of my creative background in dance and music and everything to put it towards becoming a storyteller. And so I spent the last 12 plus years producing films, screening films, curating films, and even more so incorporating other socially conscious artists who I socially interact with. And so from the beginning of my career, you know, an artist friend of mine said something very interesting. They're like, well, love your work. Your art form requires people to sit down and think, and ours requires people to stand up and dance. And I thought that was such an interesting conversational piece. And I was like, why are we not celebrating global health? Why are we kind of over analytically thinking about it? So I've done a lot to promote arts and global development. I do a lot of work and I curate performances, and I really try to push the idea that artists who, in this context for this webinar, really have their thumbs on sort of the local culture. Why are we not engaging them more in conversation and the processes around global development? I often see artists, and I work with all sorts of artists, youth poets, musicians, steppers, beatboxers, filmmakers, and whatnot. But why is it that when we invite artists into our space, we're only seeing them as sort of token performers? Whereas I think that they offer a lot in terms of being able to relay concerns of a community, and they also have, you know, incredible power at the community level. And then I'll just end by saying, so, you know, I can rattle off all the things that I've done. I don't want to use the space here, but I'll say that in my work, what I've learned is that it's critical to embrace, I think, arts and culture in our work, because at a time where we're looking at the messaging, for example, with the new, you know, SDGs and the new global development agenda, I think it's critical that we start thinking about rewriting the narrative. And I think socially conscious artists, and by that I mean artists who are also entrepreneurs, educators, mentors, they help change the narrative from one of charity that we've been so accustomed to provoke pity, to one of justice to promote empowerment. And I think that I just think it's a critical area and a missed opportunity that we're not tapping into as a global health and development community.
Wonderful. Thank you, Lisa. And our final panelist, Richard Stolnick, please also introduce yourself and share your key lessons learned.
Jennifer, thank you very much for the honor of being on this panel, and for Unite for Sight's always really wonderful work. Besides my exceptionally fun role right now as a grandfather, which is certainly my number one role, I'm now devoting myself to being an author on key global health issues and the instructor for a new course on Coursera called Essentials of Global Health. I've worked about 40 years on international development, including 25 at the World Bank on health and education in low-income countries. Following that, I taught global health at the George Washington University, was the executive director of the Harvard PEPFAR program, was the vice president for international programs at PRB, and the instructor for global health courses at Yale College, the Yale School of Public Health, and the Yale School of Management. It's especially relevant to today's topic to note that my global work started, when I was a high school exchange student to the Philippines in 1966, which people will be amused to know was the first time I'd ever left home and my first airplane ride. And I'm about to go back to the Philippines, which I've been doing for 50 years, to celebrate my 50th high school reunion, where, of course, I'll be the guest speaker and the inductor of class officers, as anyone who knows the Philippines will appreciate. I have 5, I think, of my most important one-line lessons on cultural competency to note. The first is start with humility. It's essential to know, what you don't know, and when you need help. The second is, if you can, launch the quest for competency with immersion in a culture other than your own. If you live in Washington, D.C., you could go to East Baltimore, Maryland. If you live in Boston, you could go to Berea, Kentucky, or we could all, if we're in the United States, go to Wendjima, Liberia. But this is really essential. 3, you need to learn languages. It's impossible to know and understand cultures if you don't know and understand languages. 4, you'll never know all the answers, so learn what questions to ask. The answers are rarely the same, but the questions are generally relevant across cultures, I believe. And finally, as David said very well, as he always says things so beautifully, you can never learn enough about the history, culture, politics, economics, and health systems of the countries you work on. Thank you very much.
Thank you so much, Richard. And thank you to all 7 of our panelists. As you heard, they have such a wealth of expertise and guidance to share with you today. Now we'll proceed with the question and answer session. As mentioned, we received questions in advance from you, our audience members, by yesterday's question submission deadline. If you have additional questions, please post them in the text box on the left of your webinar screen. And our first question is for Richard. When you hear the phrase cultural competency, what does it mean to you?
Jennifer, to me, I think one is culturally competent when we understand how people approach key issues in their daily life in different places and different cultures, especially as they affect the matters on which we're working. But then I think, as David has also said well, to be culturally competent, we also have to know, and others have said too, we have to know how to engage with different cultures in ways that people in those cultures regard as understanding, respectful, and insightful.
Terrific. Thank you so much, Richard. And Jordan, a question from an audience member is, in my own work with emerging global health leaders, I've begun to use cultural humility as a framework to push practitioners to consider their orientation to others through an investigation of power and privilege. This framework has catalyzed valuable conversations on cultural relativism, such as when we should adopt cultural norms and when we shouldn't, and all the nuances in between. How do you see these 2 approaches, cultural competency and cultural humility, working together?
I think it's a great question. Once again, I'm challenged to improve upon some of the things I've already heard my other panelists say, or to differentiate my answer so thoroughly. But I actually think this is a good thing, and what I mean by that is the reason some of these answers are going to start similar is the answers are similar. And if there's a takeaway from this call, I hope it will be to hear some of the similarities in our answers, because there are some fundamentals. I think Richard just went through some of kind of his 5 fundamentals. I think that's a great approach when talking about this topic, because I think the fundamentals are so important, and sometimes we're searching for something more complex or to differentiate an answer that we haven't heard before. But instead, I'm very much in favor of going back to the core of what it takes to actually appreciate the relationships you're going to need to have success in achieving the goals that we're all seeking. So, to bring up the theme of power and privilege is very important. I think a lot of power and privilege has to do with structure and not procedure. And I think we have to look at those of us who end up controlling some of the ways we place people into these situations. I don't think that often maybe some of the young people who are listening to this call or people who go in as let's say, volunteers, as I did so many years ago, necessarily have the ability to change the dynamic of power and privilege, no matter how well trained they are, no matter how humble or how much humility they have. They have to be placed in situations, too, that are appropriate for what their expertise is. We've heard some of the panelists give great advice on the types of things you must acquire in order to do it right, but we're talking about languages, we're talking about understanding of culture, we're talking about visiting places, we're talking about long-term skills that you have to learn in order to do certain things right. And therefore, it's a responsibility of those of us who have the responsibility of placing people and putting people in jobs and volunteer opportunities to know where inexperienced people should and shouldn't be, because if you're put in the wrong situation, the power and privilege is going to exist, and you might not be skilled enough yet to navigate it. And I think really the things you're going to need to learn how to do that are going to be the failure, first and foremost. For me, having the humility to not necessarily overstep a boundary or understand where, my, let's say, academic knowledge might be strong, but truly know my weakness in where I am and what the appropriate thing to do came from making some of those mistakes and hopefully in situations where it wasn't catastrophic, but rather I could be corrected. And as so many of the panelists have already said, being open to knowing what that is, to be aware of yourself and to show that sometimes you can accept that criticism, and that criticism might not always come explicitly because of the power and privilege dynamic. And we have to understand that sometimes our behaviors are not exactly what offends or what causes the trouble. It could be an attitude that can be picked up on beyond a simple behavior or a word or, putting something in the wrong place or holding your hand in the wrong way or making a symbol or a word that is offensive. It can be something that's deeper. And I think we talked about it already in the discussion of not thinking that you know more because you may be more educated in a certain subject. Know that there's a tremendous weakness in not understanding the culture, and take it as equal to what might be lacking in someone else's learning or possible skill set due to where they come from.
Terrific. Thank you, Jordan. And Vanessa, as we are discussing cultural competency, we need to consider these skills and strategies both in one's own local community and in other communities. How does cultural competency training compare and differ for those working in their local communities and local clinics and hospitals versus those working in an international setting?
It's a tricky question because the truth is, culture is a really complicated word, and culture is not just sort of the nations that we grew up in, which I think is a lot of where we sort of assume when someone says culture divide. But there's culture racially, ethnically, there's cultural socioeconomically, there is culture to the kind of education that you grew up in. And not that I want to infuse this particular conversation about our current election in this country, but this election a lot was about differences in culture within our own country and cultural outlook on sort of how to solve problems. And so, I'm not sure there is a huge difference, truthfully. It might feel, in what is overt, might feel like a bigger divide when you are working internationally because people tend to look different. The history is different. The clothing, the dress, the food, the weather, everything is so different that it might feel more perceptible. But I think there are great differences to culture just even within our micro communities here. And I think that we tend to almost overlook those more, and we are less open to those cultural differences when we're working here at home. Now, that said, I think that one of the major differences, and this does exist in this country too, language is a really big deal, though, because not only can you not sometimes understand, this is an international setting, not only can you not understand oftentimes the big picture of what's happening, but there are turns of phrase that, one interprets literally. You may misunderstand what one is saying. And I'm trying to think of a good example. If someone were to say here, they're quick as a whip, you might not know what that means. You might be deeply confused if someone were to give you some equivalent in a different language. And oftentimes I think those things can be very lost. And my father-in-law is a first-generation American, and he came here to study. And he didn't, he always tells me stories of not being able to understand the medical terminology that people threw out because everybody used slang. And he had to buy a dictionary of slang to get himself through his training to understand. And it's probably the biggest one that I would say is most perceptible. But again, those language barriers can exist very much here at home, depending on the communities you're working with. So I'd be careful about making a distinction.
Wonderful. Thank you, Vanessa. And Paul, what is an example of someone's actions who thought that they were being culturally competent but were not? What should they have done differently?
So I'm gonna flip back to one of the international ones, but just want to echo what Vanessa just hit on is absolutely so true. We think so often in terms of the international or the ethnic differences, but along technology understanding, health versus non-health workers, all of those cultural divides are far more important. One in particular that I've experienced quite often coming from private sector, international, business executives, going into East Africa, even China, Latin America, and elsewhere, there's this real, we're here to focus on business mentality. And, any sort of, talk about family or personal issues is almost seen as, okay, that's just small talk, that's just introductory. But, for most people I've worked with, in other countries outside of the U.S., the family and the importance of family, can't be, overstated. And so to avoid, to blow off dinners because you have emails to do or not, show genuine interest and spend time talking about family or other personal issues is taken as a real affront in a sense that you're only interested in business. There's only, sort of a single view that you have, and why you're there, working with these particular organizations or other people as well. So I think being very sensitive, to, both the personal and family priorities that your partners and your collaborators, have, instead of just assuming that you're only there to be doing business is very, very critical.
Fantastic. Thank you, Paul. And David Boyd, oftentimes global health programs work to analyze pre-course and post-course levels of cultural competency. What are some pitfalls to avoid when teaching cultural competency, and do you think that cultural competency is something that can be quantitatively measured?
Great. Well, as the other, like the other David, participating in the webinar, our global health majors at Duke also are required to spend 8 weeks working in the field, either internationally or in the U.S. In low resource settings. So we think and have talked a lot about this, and not only teaching, how do you teach this idea of cultural competence, but how do you evaluate it? So let me, if you don't mind, divide the question into two parts. One is about what are pitfalls to avoid when you're teaching cultural competency, and then I'll move into the evaluation. I think the most, if you think about, if you look at the various checklists and the various metrics that are used to evaluate cultural competency, I think that you find that that many of them are based on an assumption of sort of an Anglo-American highly educated male going into another culture. And what that does is it creates this sense of my culture, my position, my positionality is the norm, and I'm moving into this other. What I have found to be much more useful is to denaturalize the student's sense of norm and have them understand that actually where they're going to work, they are the other. It's the reverse. And I have found that shift actually helps avoid the main pitfall, which is the student simply seeing their position as the norm, and then they simply have to learn a checklist of differences that another culture, that the other culture might have. This for me has been, I think, one of our biggest issues. That being said, I'm skeptical to what extent cultural competency can truly be quantitatively measured. I think that quantitatively you could measure some of the underlying principles, sort of as was said earlier, some of the sort of meta principles underlying these issues, that students understand this sense of empathy, that they understand their positionality and other positionalities, the sense that they understand that no culture is a monolithic construct. It's actually an it's a web of narratives that vary based on multiple perspectives. Otherwise, I think qualitative measurements are probably better, because if you even look at some of these scales that try to use quantitative measurements, it really turns into this kind of checklist. And what I have found with my own students out in the field, the students who go out with a checklist of what they should and shouldn't do, actually tend to be the least culturally competent of my students who go out, spend the first week, as Vanessa said, just getting to know people and hanging out with our colleagues.
Wonderful. Thank you, David. And a question for David Peltier. Students going into international volunteer work or research often go through pre-field work training. What are common mistakes made by pre-training programs, and what are some areas that absolutely should be covered but often are not?
I'll try to answer the second question, because I'm afraid I don't know what the common mistakes are that are made elsewhere. I only know our own mistakes. And I'll take a page from Richard's approach. I have two categories and 5 points in each category that I think are important. The first category is basics, and the second category is values, orientations, and skills at a deeper level. So with regard to basics, the 5 areas that I think would be important to cover are the first obvious one of personal health, safety, and security. The risk management people at our universities will make sure we cover that. The second would be the country context, as I mentioned earlier, the national identity, the ethnic and political diversity, and how the healthcare system is organized, and so on. The third would be cultural norms and etiquette regarding a whole range of things from gender and dress and social distance and greetings and handshakes and authority and hierarchy and all of that. The fourth would be, I certainly agree about the importance of language, but I also know that in many programs there's no possibility of bringing students to the kind of level of fluency and understanding that we would love them to have, and often it's much more basic. And so I think at the very, very minimum, and it's important to recognize it is a minimum, they should have the basic languages of greetings and so on, just simply as a sign of respect. There's a big difference between being able to greet appropriately and not being able to do so at all. And related to that, the fifth point under basics would be professionalism in the context where they will be working. If they're not strictly in the community, but if they're working in a hospital or something, what are some of the norms of professionalism that they should be aware of? In the second category of values, orientations, and skills, and of course these are things that, as others have said, are to be developed and acquired over a lifetime. They're not an end state. They are an ongoing process. And so the first is the understanding and appreciation of diversity and the respect for individuals in all situations and the respect for cultural differences. That's sort of bedrock. Secondly, is the self-awareness of one's own identity, background, values, privilege, tacit assumptions and biases. Related to that, an awareness of how others in that other culture are going to be viewing them. The third, as we mentioned several times at the outset, is humility, and I would distinguish 3 kinds at least: personal humility, cultural humility, and professional humility, each of which applies in different contexts. And it's helpful to contrast that with what arrogance looks like, or what expert assumptions look like in the eyes of people from another culture, because often students may not even be aware that they are displaying these things. The fourth would be replacing any kind of judgment with a deep curiosity. And the fifth, which hasn't really been mentioned yet, is managing ethical situations in the moment, especially if students are in a healthcare setting and they are asked to do a procedure or assist with a procedure that they really are not qualified to do. How are they going to manage that? And that's just one example of many. So I'll stop there.
Excellent. Thank you, David. And Vanessa, when screening participants or applicants, what are key indicators of cultural competence in an application? And also, how can choose prospective supervisors or employers in a way that is humble?
Well, I mean, I think for us, what we definitely try to do is I think the thing for us is that we look for humility, probably first and foremost, and we look for people who don't suppose that they have the right answers. And so we actually screen everybody, at least through Skype, if not in person, because we kind of want to get a sense of your body language and who you are and how you approach things and hold yourself, because those subtle cues can make a big difference. And I think that we definitely asked people to sort of help assess for us scenarios. How are they going to cope with scenarios? And I got to tell you, the people that we feel most comfortable with are often the people who say, I don't know. I recognize that will be really difficult. I may not know the answer, and I hope that I can ask X person or X person to help guide me. And I think, that sort of willingness to be open to one's own, and someone else mentioned this already, that we don't know what we don't know, and we have to be able to accept that we don't know everything. And I think that being willing to accept the difficulty of this work and to be willing to be honest about it and to accept the challenges that might bring is incredibly important. So we definitely look for that. Certainly people who have had experiences before, it's helpful for us as we screen people, but I sent somebody to be a psychiatrist in Malawi who would know international experience, and we did that and we were comfortable with it because there was a real sort of understanding, I think, and humility just to the work and to listen to the partners. And we actually do present the CVs of our volunteers to all of our partners, and they have the right to refuse if that is something, if somebody doesn't feel comfortable or for, whatever reason. And we sort of present them as folks that we think would be a good fit at the site, but it's really up to the site themselves. I don't know if that answered the question, but.
Wonderful. Yes, thank you. And Lisa, what are some common cultural competency pitfalls that you have seen with film and or social media? What should have been done differently?
So this is a big question and a very important one, I think. Again, because I've been working sort of in the arts and film world, I think one of the things that I recognize that has been a struggle even for myself is how can we stay away from telling exploitative stories when we're focusing on pressing global health issues. I struggled with this for years because, for example, I did a film about obstetric fistula, and when I go to the various countries to do my shoots, I would get questions from my artist friends saying, it's great that you're here, but when you come to, Liberia, you're always showing the bad parts of Liberia. And I would ask them, I'd say, you're right, but how do I make a film, for example, about obstetric fistula without showing the horrendous suffering that these women are going through? And that is where I really started to appreciate and recognize that changing the narrative is so critically important. But one of the things that I wanted to also focus on is that, all of us are biased in the work that we do. And I think both professionally and personally, one of the greatest gifts you can give yourself is try to understand your own biases and undo them. And I think one of the things that we can do as global health professionals, whether you're a professional storyteller or, for example, a student volunteer who's coming home and sharing stories about the experience that they've had in another country, is just understanding that the people we meet are not the problem, and also understanding that people are not one-dimensional characters. I'm trying to do a film on the impact of war on young people. One of the things that I really try to do is show them as young people first before showing them as young people in conflict. And I think that is critical not only for the work that we do and the audience that, for example, I may have, But I know firsthand experience that, you know, even though people are poor, their circumstance doesn't necessarily dictate their potential. And so some of the messaging and the films and the PSAs that come out about different parts of the world are extremely offensive to some people. I had, you know, 2 hip hop artist friends from Sierra Leone who said, you know, we love our country. We have the mountains, we have the sea, we have diamonds. And so they said they were really offended and kind of shocked when they were in school and they learned that Sierra Leone was considered the poorest country in the world, you know, according to the Human Development Index report. When I went to Ethiopia to do a film, immediately my translator kept telling me that people in Ethiopia are going to keep telling me that they've never been colonized. And this is true. I met a lot of people and they're like, did you know we've never been colonized? Did you know we've never been colonized? I'm like, why is it that they keep wanting to tell me that? And they said, because we fear that you as an American only think of Ethiopians as people who starved of famine. And that's because of the work that had been done for Ethiopia back in the 80s that kind of perpetuated this one-dimensional narrative. So I think that we as professionals, if we really want to be respectful and culturally competent, to really kind of see people as multidimensional, complex people who, you know, despite being poor or have all these, you know, issues and problems that they're dealing with, it's not them that's the problem, it's the problem that's the problem, and to try to, you know, see them in a dignified light and retain their dignity by the stories we tell about them.
Wonderful. Thank you, Lisa. And David Boies, did you ever teach cultural competency incorrectly? How did you realize if you did, and how did it change your methods?
That's a past tense question. I would say I have taught it incorrectly, and I'm sure I still do all the time, both in the classroom and with my students out in the field at my research site. I think what I realized when I think a big mistake that I made for a very long time was focusing, instead of starting from general principles and then moving into specifics, I really was focusing on sort of specific interactions and trying to teach students what to do and what not to do, in the sense that they were so overburdened with this list of rules that they were trying to learn going to my research site that they would freeze and not be able to begin the experience with that kind of sort of socialization and interaction that I think Vanessa articulated so well. So I think that was what I've learned the most. And I've also learned that students were working under the assumption that as the professor that I always got it right. And I think my showing them and sharing my stories with them about when I have not been as efficacious as I could have been, when I have made assumptions, when I have caught myself being culturally arrogant, I'm human just like anyone else, I think it's actually helped them quite a lot. And so what I really do now, especially when I'm in the field with students, is that I demonstrate not knowing, and I really show them that once you've made these connections, once you've made the bond, not only can faux pas be forgiven, but it's really okay to ask, you know, how do I? So I do this a lot with my students, and this is when we're in some of the Maya villages where very, very few non-indigenous Maya ever are, is I will simply ask a question, even though I know the answer, you know, what is the best way for me to do X? And I think the students seeing me ask those questions really frees them up, and I have found that it helps them perform much better. And that, along with my constantly having them critique and think about their own positionality, makes a real difference. I guess finally, very quickly, what I share with them also is an example of the most culturally competent experience I have ever had. I was interviewing a diviner in South Africa, and she noticed that I had fallen, had a cut on my head, and asked me if she wanted to do a divination to see why I had fallen. And she did the divination, and it had to do with, she said, jealousy of some of my colleagues. And she said, you need to go to your father's grave and make a sacrifice. And I said, okay, what kind of sacrifice should I make? And she looked at me and she said, I don't know what a bald white man should do as a sacrifice. You have to figure that part out. And that has stuck with me. And I have this on tape, and I use this a lot. That stuck with me, and it's been a great way of having students understand general principles are wonderful, and then we ask, and we learn, and then sometimes we can even laugh with the other person over our faux pas. I think I'll stop there.
Fantastic, David. Thank you. Jordan, donors often have a particular idea of what they want done, and it seems at times to be either contradictory to what the beneficiaries want, or it's a highly U.S.-centric approach that is not either appropriate for the context or culturally sensitive. How can we, as implementing partners, improve on the situation to make work more culturally sensitive and ignore the demands of the donors?
An excellent question. I just want to comment that I appreciate David's practice of intentionally displaying things that he doesn't know. But I've also become an expert of unintentionally displaying things, not knowing. But, you know, in terms of donors and being driven towards a certain type of operation that is contradictory to what beneficiaries want, the main advice I can give is to get out in front when dealing with donors. And then again, this is a long-term process. If you, as an organization or as an intervention or as a project, depending upon the work you're in, do work in a way that gains cultural competence and displays cultural humility, you will learn practices and processes that are appropriate in your setting. The key then when dealing with donors is to get out in front and present them with a business plan that is culturally appropriate and culturally humble and all the things that will make it successful, and insist up front that they buy into your vision as opposed to possibly bringing practices or a certain objective that would damage the results of the project and damage the intent of both yourself and the donor. So you have to be an advocate for that if you truly have picked up the experience. But I think it goes back to some of the other fundamentals that have been distilled here, and I think the may seem obvious, but the very important insight that people are highly complicated. Human beings are complicated. Is essential to understanding this. We do tend in marketing, in film, in all of these avenues to display characters that are relatively one-dimensional. And when we're trying to sell the work to donors, we do this the majority of the time, and it does affect the implementation of how we deal with people, because what human beings want is similar regardless of culture, and respect and dignity is at the core of this, and they want high quality things no matter where they live or where they're from. And they believe they deserve high quality things no matter where they were born, and this is an important fact to understand going in, that a handout from a more advantaged place does not necessarily translate into something great for those who were born into a disadvantaged situation. People have a conception of themselves, rightfully so, that they are valuable, that they deserve high quality things, and at the essence of that is the high quality level of respect and a high quality value of life and dignity, and that they are worth the same dignity that we would experience in a place that has more advantages. And if we don't recognize that, and if we don't display that in the marketing of our projects, and if we don't display that through the avenues of film and social media and all of those other avenues, there's no way that our program results are going to be the same, because we're going to get involved in a vicious cycle of portraying those who happen to be receiving service from these organizations as willing to accept a lower quality product than we would accept ourselves. And again, it goes back to what seems like a simple logic, and I think when we all say it on this call, it comes across, okay, yeah, we all agree on it, but we get caught up in cycles. And even the time spent with those we're working with, it was mentioned that, we run past our colleagues and skip dinners and skip small talk and skip that human interaction, because we're prioritizing a million things. But we do have to value the relationships, and that just goes back to the fundamentals of valuing relationships. And we all have to decide going into our work how much we are going to prioritize those relationships. And it's not a simple thing, because that's not easy when we start thinking about our workday and the project cycles and the donor demands and all of those things. So unless we're going to push back on the philanthropic community, the donor community, and explain these things that we're talking about in this call transparently and openly, we're not going to necessarily make progress, because, again, it's structural. The structural inputs of the grants themselves are going to call for fast. And the things that we've just agreed are the things essential for cultural competency will not happen.
Fantastic. Thank you, Jordan. And Richard, before traveling to or working in a new setting, whether locally or internationally, what are steps that you take to best prepare yourself?
Jennifer, thanks again, and thank you again for the opportunity to learn so much from such talented and interesting participants. Before I work in a new country, I try to find out what 10 books can give me the best understanding of the country, what 10 movies, Lisa will be pleased to know, and I agree with her, can give me the best feel for the country, and who are 10 people who really know the place with whom I should lunch or learn from about the country as well. I then read the books, watch the movies, and have lots of lunches and phone calls. I also talk to myself about how key issues play out in that country on which I'll be working, and try to identify the key questions related to local culture that I'll have to ask if my work in that country is to be successful. While at the George Washington University and Yale, I organized internships in India and Bangladesh for about 10 of my students each year. And I required and beat them up mercilessly to ensure that before they got on the plane, they read the 10 books, watched the 10 movies, and met or spoke with the 10 people in order that they could have as good a feel as possible for the country to which they would be going, even as they thoroughly and completely understood, as everyone has said so well, how little they knew and how humble they had to be as they entered this new set of relationships. And I actually have in my reference files lists of the 10 books and 10 movies for a substantial number of countries that friends in those countries have been kind enough to put together for me and for my students as well. Thank you.
Wonderful. Thank you, Richard. To all of our panelists, this brings us to the conclusion of today's webinar. We had such a phenomenal dialogue and discussion today, so thank you so much once again.
Thank you.
Thanks, everyone.
Thank you.
Thanks to everybody. A pleasure.
Thanks.
Yes, bye-bye all.